I'm Peter Block here at TCT 2018. On my left is Lisette Jensen from Denmark, and we were just talking about her trial, the SORDOT 9 trial. Lisette, tell me about the trial very quickly, what the differences in these two stents are. There's been a lot of SORDOT trials. This is number 9, so why did you do this trial?
We did this trial, we compared two different stents. One of the stents had a biodegradable polymer and the other one did not have a polymer. That was the interesting part. We wanted to assess the drug of the two stents were different, and also the releasing time. In the first stent without the polymer, the drug was released already within a month, and the other stent it was released within 3 months. I think that was the major differences in the stent.
So that 1 month versus 3 months a drug release may be a difference that would make a difference in the outcomes. So having said that, randomized trial, how many patients?
We randomized 3,151 patients, 1-to-1.
And having said all of that, tell me a little bit about the outcomes.
The outcome was target lesion failure, a composite of cardiac death, myocardial infarction, and target lesion revascularization. And we wanted to prove that the stent without the polymer was not inferior to the other stent. And that was what we found. We found a target failure.
Target lesion failure, I bet you, is what you're trying to say.
Correct.
Yeah, right.
Of 4.0 in the one with the biodegradable polymer and 5.3 in the other group. So there was no difference there, but when we assessed the target lesion revascularization rate, there was a significant difference with more target lesion revascularizations in the one without the polymer and the one who released the drug fast.
That's interesting, because that's what we said at the beginning. Maybe there would be a difference. Now, the release of the drug within 30 days and then no further drug might lead to a little bit later restenosis. Is that right?
That is right, yeah. But an important part was that the safety was equal for the two stents.
Okay. So the bottom line here is not necessarily the subgroup analysis, which isn't that critical, but the fact is you have a non-inferior difference between the two. Am I correct in saying
Yes.
that? All right. So going forward, we have a lot of trials now where we're comparing one stent versus the other. Many of them are non-inferior trials, and many of them turn out to be just that. So what does this mean in terms of what your practice may mean in Denmark?
I think the stents are so good nowadays, it's difficult to prove superiority in stent trials. I think the one stent with the lowest target lesion revascularization rate is an all-comer stent. It's a good stent, and the other one has we saw more restenosis, but that stent has the indication that you can reduce the length of dual antiplatelet therapy.
Yeah, that is always an important issue, particularly for people who need surgery or whatever, rather than use a bare metal stent, right?
Right.
Which is the other option.
Yes.
And they seem to be going away, don't they, the bare metal stents?
We don't use them much, but we still have them.
Yeah, every once in a while we use them as well.
Yes.
Okay, thank you, Lisette.